Hello, everyone. After reviewing this week's readings, I realized that Chapter 7 is mainly about anti-infective agents and their role in dentistry. Anti-infective agents are substances that inhibit the organisms from causing infections. But first, in order to prevent an infection or to treat an infection from happening, one should understand what type of microorganisms that are involved, such as bacteria or fungi or viruses. We also need to consider the number of organisms, the environment that it's in, or the host that it's upon. The patient's immune response would also need to be evaluated and considered to treat the infection safely and effectively. Other agents that help treat or prevent infections are antimicrobials, antifungals, and antiviral agents. Common ones used in dentistry are antibiotic prophylaxis, such as penicillins, tetracyclines, clindamycins, and amoxicillins. It's also very important that the correct dosage and time of duration of only one antibiotic is to be prescribed. Additionally, it is critical that the patient is educated on the importance of taking these antibiotics to ensure that they understand the reason why they are being prescribed the anti-infective agents. Okay, so now as for chapter 14, it's about seizures and the drugs to treat these disorders. Seizures are grouped into two major groups known as generalized and partial seizures. Generalized seizures consist of tonic-clonic, myoclonic, akinetic, and absence. Partial seizures consist of simple, complex, secondarily generalized, and temporal lobe. For generalized epileptic seizures, the patient may feel what they call an aura, which is described by various onsets such as sensitive to light, sound, smell. They can feel nauseous or numbness. And epileptic seizures can be treated with diazepam, Valium 4, phenytoin, and phenobarbital. When the patient loses consciousness and they have little movement, this is known as an absence seizure. So absence seizures are treated with ethosuximide. For tonic-clonic seizures, where the patient loses consciousness for a longer period and has more body movements, this type of seizure is usually treated with valproate, lamotrigine, and levetiracetam. As for partial seizures, it is when one part of the brain is activated and can be simple, and their consciousness is not lost. And on the other hand, complex partial attacks is when the consciousness is lost and it lasts for several minutes. These seizures are usually treated with lamotrigine, carbamazepine, levetiracetam, and oxcarbazepine. And other drugs that are not anticonvulsant that should be considered or used with precaution or should not be used are NSAIDs and opioids. These should be avoided with seizure medication, such as phenytoin, because it can have an adverse reaction on the patient's gastrointestinal system. It can induce nausea, vomiting, diarrhea, and abdominal pain. And so, a key takeaway that I got from this chapter is that some anti-seizure medications can cause gingival enlargement or reverse side effects. So it is important that the patient be scheduled more frequent for hygiene appointments and provided good oral hygiene instructions. Okay, that's all for now. Happy 4th of July, everyone. Have a safe weekend.